Welcome back. Say you just woke up and your head feels a little stuffy.
Or maybe your throat's a little bit sore, or perhaps you just sneezed. Is it a cold? Is it the flu? Or is it COVID?
For the record, we all tested negative. So that applies to none of us here. But it is the question that does have everybody on edge these days, as we're now starting to see the flu season arrive. New CDC data shows that the number of states with high flu activity has now more than doubled over the last week, and hospital admissions for the flu are up by 34%. NBC News senior medical correspondent Dr. John Torres is now here to break it all down for us. Dr. T, nice to see you. Help us out here. A lot of people are concerned about this, the way things are looking. What is the latest on the flu situation across the country right now, and what really are your chances of contracting it versus COVID?
And Peter, great to see all of you as well, and hopefully you had a great holiday season so far. But one of the things you have to realize is right now the flu season is just starting to ramp up. Last year it wasn't much. This year we're starting to see some cases, but we're just at the beginning of that flu season, and we know that COVID cases are accelerating dramatically right now. So if you start getting sick, essentially you have to assume it's COVID unless proven otherwise. And by that I mean make sure you isolate yourself, get a test to make sure it's not COVID, and then you can start looking at the flu and cold. As the season goes on, the flu might become more common as well as the cold, but right now, COVID is the name of the game, Peter.
Dr. Torres, we've all been reporting on the strain on hospitals given the increase in cases and, of course, given staff shortages. So how much of a threat is the flu season to hospitals, given that they're already overstressed?
And Kristen, even in the regular season, without the pandemic, hospitals are always right on the edge, especially during flu season, of being pushed over to where they can't handle the patient load that they have. You put COVID on top of that, that makes it even more likely. And if you remember last year, we kept our fingers crossed that flu wouldn't be a bad season because our hospitals were super strained. We're at that point right now, so the flu is just going to put them over the tipping point. And remember last year when we had lack of ventilators, we had lack of medicine, lack of staff, we could get back to that point again, and that's why we have to be careful this year and make sure we protect ourselves from the flu and from COVID with the vaccines we have out there so we can help ourselves, but also help our hospital system, which helps everybody else.
Hey, Dr. John, it's Jacob. You know, we're all thinking about our kids, and I remember last year, I think there was only one pediatric flu death recorded total, and 200 the year before. They're now expecting, I think, that number to come up again this year. Can you explain why that is, the difference between last year and this year?
And right, Jacob, last year we didn't have any flu, and that surprised everybody. I talked to doctors who said they didn't see a single flu case in their ER. And as an ER doc, I never had a season like that. But we're still towards the beginning of the flu season. The CDC says it's starting to see a slow but steady increase. So far, it's been in children and young adults. And like you mentioned, one pediatric death last year. So far this year, we've had 2 pediatric deaths. But right now, Omicron, which is the variant we know is highly transmissible, that's again more likely you're going to have that. So get tested. If you feel sick, don't just assume it's the flu or the cold, because we're going to start seeing more cold coming up. But for right now, Omicron is the one we have to worry about.
So, doctor, let's talk about the main differences between that new Omicron variant and the flu right now. A lot of people who get Omicron, who get COVID right now, say it feels like a bad cold. Is there a marked difference between the two?
And there are a little bit of differences. You know, with the previous COVID variants we have, including Delta, the main sign was that loss of taste or smell. People complained about that. We're not seeing that as much with Omicron, even though that's becoming more dominant across the country. But people are reporting night sweats, which is a very strange symptom that they say they're having. The other thing, the onset of the symptoms. And with cold and with COVID, it seems to be a slower buildup of symptoms. You just get them over days. The flu hits you right away. You get a fever, stuffy nose, body aches. And if you've ever had the flu, you know you get to that point where you can't get out of bed. You know, let's go through some of the symptoms of all these here. If you look at it here, cold symptoms, again, runny nose, stuffy nose, sore throat, cough, congestion. Those are the main ones. With the flu, you're going to get fever, cough, sore throat, runny or stuffy nose, body aches, and a headache. And then with the COVID symptoms, especially Delta, headaches, sore throat, runny nose, fever, body aches. Those are the biggest ones. And with Omicron, cough, fatigue, tiredness, congestion, and runny nose, you notice there's a lot of overlap in those symptoms, and that's why it can be so hard to tell the difference between all of them, but there are a few differences.
Dr. Torres, when should you actually get a test or just ride it out?
And Kristen, one of the biggest things is you want to avoid self-diagnosing. That means if you're displaying any symptoms, you want to go ahead and get tested. Again, assume it's COVID until proven otherwise. Go ahead and get a flu test, and COVID test, and depending on your symptoms, you can also get tested for the flu at the same time. And not trying to complicate things more, but we're also in strep throat season, so you might need to get that test as well. So avoid people in general if you're sick. But if you have COVID, obviously there's some strict protocols, and like you mentioned, those have changed a little bit for isolation. So you do need to isolate longer and inform some close contacts about the spread of it until you get a diagnosis of whether you have that or not.
What about the vaccine, Doc? Is it too late already to get the flu vaccine if you haven't gotten it yet? I know a lot of people are worried about that.
No, it's not too late at all. It takes a couple weeks to take effect, much like the COVID vaccine and the other vaccines that we get. And so you can get it right now. Like I mentioned, we're at the beginning of the flu season. So getting it right now can protect you if it hits us hard in January, February timeframe. But you want to go ahead and get it now. Again, it's going to make you feel a little under the weather for a day, much like the COVID vaccine, but it's your best protection. Might not protect you 100%, but it can keep you out of the hospital.
And all right, doctor, let's say it's your turn. You get one of these things. What's your best treatment? What do you do?
So your best treatment is to go ahead and get over-the-counter treatment, treat it at home as best you can. And so you want to use acetaminophen or ibuprofen. That's for fevers and body aches. For stuffy nose and over-the-counter decongestant like guaifenesin, which is Mucinex. Hydration and electrolytes, extremely important. Plenty of rest. Sleep is one of your biggest aids you can use right now. That lets your body recuperate and regenerate itself so it can protect you, and it keeps your immune system strong. And if your symptoms get worse or you have difficulty breathing in particular, remember, we're in the middle of COVID season, which is a respiratory illness. You want to go ahead and see a doctor.
Dr. Torres, thank you so much. You just saved all of America a copay today. We appreciate you.
Thanks, Dr. Torres. Great info as always.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.